Let's talk about the dreaded complication, capsular contracture with breast implants. What, when, how, why? Do you need surgery to fix it? Let's talk about this controversial topic in plastic surgery. So what is capsular contracture? Well, you have to take a step back and figure out what is a capsule. So whenever we put an implant into your body, or any foreign body really, if your body can't spit that object out, it's going to try and wall it off with scar tissue. Then you get a foreign body response. And around a breast implant, that foreign body response happens and your body tries to wall off that foreign body, the implant, with scar tissue. Everybody's different on how thick or thin that capsule is going to be. In general, it's almost a bell curve, except it's slightly skewed towards a thinner capsule than a thicker capsule. But you have tails, just like in a bell curve, where some people are going to form very, very thin or non-existent capsule, and other people are going to form a much thicker capsule just normally, okay, without any abnormal process going on. Why are capsules important? Well, the capsule, that scar tissue that's around the implant, is going to be one of the main factors that will help hold that implant in position on your chest wall. Ideally, it's thick enough to do the job against the forces that are acting on your implant, which depends on where your implant is in your body. If it's above the muscle, it's just gravity pulling on your implant. If it's under the muscle, you'll also have gravity and you'll have the force of your muscle contracting across the top, trying to squirt that implant out of position. And you want to have good capsule there to hold the implant in place. Otherwise, it all has to be on your soft tissue. And as anyone who's had babies know, the soft tissue, i.e. the skin and support tissue under the skin, is designed to stretch. Okay, so we don't really want just your soft tissue to hold the weight there. It probably won't do a great job of that. So capsules are important, right? They have a function and they're not all abnormal. So what is capsular contracture? Capsular contracture is more of a pathologic process where the scar tissue around that implant, the capsule, has gotten thicker, and it may still be getting thicker. And as that process happens and it gets thicker and thicker, the scar can start to contract around the implant, start to squeeze it. Pressure goes up, the implant balls up, becomes firm, and can become painful. And so we call that capsular contracture. But the line between these things is kind of blurred. It's a spectrum. We know certain things can cause capsular contracture, and it's not just one thing. We know radiation from the outside for treating a breast cancer around an implant, that can cause capsular contracture. We know having too much blood around the implant at the time of placement might also trigger a capsular contracture to form. And kind of the most commonly implicated one for cosmetic surgery is going to be bacteria that gets on the implant shell. These bacteria, they come from a variety of sources, probably most likely is from the breast tissue itself, and they form a biofilm on the surface of the implant. Your body sees that it's there but can't scrub it off, so it's going to try and wall it off, and so that can initiate a capsular contracture. So capsular contracture, having extra thick capsule around an implant, is it always bad? Well, not necessarily, right? So I've had patients come in with the capsular contracture. Usually it's on one side. So the implant's sitting up rounder and fuller, and the other implant has settled and softer. Oftentimes these patients will come in not to complain about the firmer, rounder, higher up implant, but the softer, squishy, settled implant, and say, I think this is the problem, the softer implant. And I get to tell them, well, in fact, actually the capsular contracture side is the quote unquote abnormal side, and the softer settled one is what we would expect, is more normal. What if though you get capsular contracture on both sides? Both implants are sitting up high, they're supported by a thicker capsule, it's not yet gotten painful. We're not sure, if it's due to a low-grade bacterial infection or not, but assuming it's not, is that necessarily a bad thing to have more support around your implants and have them sitting in a higher position on your chest wall? I would argue probably not, right? When does a capsular contracture become a problem? Well, if patients are having a low-grade bacterial infection of some flavor, then that's probably not ideal, and you might want to consider revising your implants for that reason. Two is if you are, and this is probably the most common scenario, where you're getting progressively thicker capsule around your implant and it's starting to become painful. In my mind, I separate it between, is this a cosmetic only issue, or are we starting to get into a functional problem with pain? that's kind of my threshold there is, are we starting to develop more of a functional problem rather than just a purely cosmetic one? And if so, how bad is that functional problem? And can that outweigh the downsides of having revision surgery? Right? The costs, the consequences, the complications, the downtime, all of that stuff. And so the upside has to outweigh the downside. And so that's how we will decide, is your capsular contracture a problem, or is it something we can observe? And that's an important thing to figure out, ideally at your consultation with your plastic surgeon. If you'd like to set up a consultation with me at Alamo Plastic Surgery, reach out below or send us a direct message. We'd be happy to set something up for you. Take care.